Okay, I think we can go ahead and get started. So welcome again to everybody who's joined today. It's really great to see so many of you here. My name is Rose Hendricks. I lead the Society Civic Science Initiative, which is a network of scientific societies and associations who are working to support their scientists who engage with public and policymaker audiences. And I've gotten to know the folks at the Center for Public Interest Communications over the past year or few years and have gotten to work with them and perhaps more importantly, admire their work. So was really excited to see their work on COVID-19 vaccine communication, since really all of us have opportunities to engage in productive conversations on this topic. So I reached out to them and they were willing to share their work with all of you today. So with that, I think we'd just love to hear from you. And Anne, I'll turn it over to you to kick us off.
Great. Thank you so much, Rose, for this opportunity, and to all of you for joining us today. Rose, we are very much in the Mutual Admiration Society and incredibly respectful of your work and our opportunities to collaborate. I'm joined today by two of my colleagues, Jack Berry and Brendan Martin. Jack and Brendan collaborated in the development of the guide that we're going to share with you today, along with some of our additional amazing colleagues, Annie Neiman, Ellen Nodine, and Matt Sheehan. So this project came to us through Purpose, an organization that's globally based and focuses on social change. They had been working with the UN Verified initiative to begin to address misinformation online, particularly working with UN communicators. And so they reached out to us at the end of August, early September, to ask whether we might help them develop a science-driven message guide for overcoming vaccine hesitancy. We understood that we had to work very quickly to make this happen, recognizing that with vaccines coming out at the end of the year, we had very little time to create something that would be useful to practitioners and that would be science-based. So what we shared with you today, we produced over a period of 8 weeks. We worked very hard to be as comprehensive as possible and to look at insights from as many disciplines as possible. And I want to acknowledge that we offer this with a great deal of humility and recognize that we did the best that we could as quickly as we could, and we see this as a really solid start. So I'm eager to hear, as I know Jack and Brendan are as well, to hear your comments, questions, and observations today. As presenter, I can't see the chat, but Jack and Brendan will be monitoring and jumping in, and Jack will also be sharing many of the insights we gained from a survey we fielded this fall in the US, UK, Germany, and France. So with that being said, let's dive in. So recognizing that we had to work very quickly on this project, we used an approach that we've used for a few other projects where we had to quickly discern what research tells us about a really important and immediate challenge. So Annie Neiman, our research director, quickly scanned the field to identify some of the foremost researchers who are doing work in vaccine hesitancy, who were doing adjacent work that we felt that we could learn from. And we identified 16 scholars who we convened several times over a period of 5 days with critical questions around vaccine hesitancy. We recorded and transcribed those conversations, and then our research fellows, including Brendan, looked for a series of themes across those that we will share with you today. Once we identified those themes, we shared those back with the researchers to verify that we had gotten it right. And that's what we're going to share with you today. So Our first step was to identify some of the leading scholars in vaccine hesitancy. We followed up with these in-depth conversations. We extracted these 8 core principles, and then we tested the principles through a survey that Jack fielded in the UK, Germany, France, and the US. So why is this so important? We're not sure what percentage of people will need to have the vaccine for us to achieve herd immunity for COVID-19. But for other diseases, we've seen that range between 85 and 95%. With vaccine intention and acceptance rates only around 60%, that leaves a huge gap. We're particularly seeing hesitancy in some really important communities. For example, at the beginning of this call, we were just talking about some of the recent news about healthcare providers, particularly in nursing homes, showing high levels of hesitancy. So these are really big challenges that we have to overcome if we are going to be able to protect vulnerable people from COVID-19. And this is also important because, as Jayven Babel, one of our participating scholars, said, is that you could create this whole new category of society that's vaccine hesitant if we don't get this right. So this isn't just about making sure that people decide to get the COVID-19 vaccine. This is about subsequent generations of potentially vaccine hesitant people. So I know we're talking with a group of scientists, and you understand this at a visceral level. All of this starts with trust. It's weird to inject a foreign substance into your body or to make that choice on behalf of somebody else. So our ability to trust that vaccine isn't going to hurt us, that it's going to work well, that it's not going to hurt our loved ones is really important. So there are lots of factors that are underlying our lack of trust in vaccines. There's this perception of inconsistency around reporting about the vaccine. In the news lately, we've seen discussion about whether or not we should be putting off giving people the second dose so that more people can get the first dose. So this creates confusion and uncertainty, which undermines trust. We also see in the media that this issue of false balance, that when 2 sides of a story are covered, that people hear that and presume that they have equal weight and equal merit, when that's certainly not the case. We're certainly hearing lots of the wrong messages from those who may have a strong anti-vax agenda, and even some policymakers who have expressed vaccine hesitance, or doctors who are saying things like, let's wait and see before we give you that vaccine. We also, many of the people who are communicating on this have a great deal of expertise, but expertise to people who don't share that expertise can come across as abstract. We're seeing a lot of the wrong messengers. Certainly elected officials, politicians talking about this issue can create that sort of undermining of trust. And we're also seeing some unfortunate timing where coincidental events are being seen as having an influence on the timing and availability of this vaccine. So these are the 8 principles that we're going to go through today. We're going to talk about worldviews, timing, messengers, narratives, relationships, social norms, emotions, and motivations. So let's jump into these. So our first principle is that we have to work within the worldviews, identities, and moral values of those with whom we're trying to connect. We waste so much time as communicators trying to convince others to share our sense of right and wrong, to share our perception of why a choice is good or bad. And the reality is that we need to be able to understand how they see the world, not try to get them to see the world as we do. So worldviews are that collection of stories and expectations of the world. They guide how people think that the world works. And one of the things that we've seen is that identifying the worldview of a community is really critical for a campaign to be able to identify some messages and solutions that will resonate and avoid the ones that are going to lead to information avoidance or perceived threat. So one of our participating scholars, Emily Brunson, is a medical anthropologist. And one of the things she talked about is that US parents have concerns that go way beyond traditional public health messages. This is not simply about getting the message out, getting the word out, that we need to be thinking about what their understanding is, what their hopes and fears are, and to be communicating in a way that makes sense within their worldviews. So identities are the groups we see ourselves as belonging to, we self-select them, and people within identity groups share beliefs and norms. So I see myself as a sister, I see myself as a mom, I see myself as a college professor. What's important about identities is that we're unlikely to engage in behavior that separates us from the groups with which we identify. And what's also important to recognize about worldviews and identities and moral values, which we'll talk about shortly, is that we don't interrogate them. We're not even aware of our own moral values, identities, and worldviews, which can lead us to entering into these conversations deeply rooted in our own mindset without a lot of compassion or understanding that somebody else may have a very different one. So Monica Skopspana said that what's going to be compelling for some audience is what resonates with their personal values. So if you've got somebody who's a rugged individualist, you could talk to them about the freedom to go back to work as quickly as possible, or to get to your place of worship, and really inspiring that sense of agency. But for people who are not, don't share that individualistic mindset, they may be doing it more for other people, being responsible to their community or to their family. So our moral values are heuristics that guide our decision making, and they serve as that basis for quick judgments of what's good and what's bad. And they may be the underlying reason for some different motivations across different cultures. And so moral foundations theory gets at factors like loyalty, fairness, care, authority, and sanctity and purity. And they look different for people who are conservative or liberal. If you look at the liberal moral values like protection from harm and fairness, for example, you would see that those are not necessarily shared. Those liberal values are very much sort of what a journalist may subscribe to, that they see themselves as protecting people by sharing facts and sharing compelling stories. But you could see why somebody who had a more conservative set of moral values may be put off by that because it doesn't align with how they, what they see as being right and wrong.
Hey, everybody. As Anne mentioned, I'm Jack Barry. I'm a postdoc with the center, and I study political economy and political communication. And as part of this project, we wanted to test as much as we could of the messages across different demographics and across different countries. So as Anne mentioned, we ran a survey with 1,600 people across the US, Germany, UK, and France. And we did this survey in October of 2020. So there's been some other studies about demographics on hesitancy. But what's pretty unique about our survey is we were able to test a whole range of questions, including moral values. And we found some interesting findings here, as you can see in this breakdown of our survey questions. So we saw significant differences for people who were more loyal to their in-group compared to those that were not as loyal to their in-group. With the more loyal group, the more loyal one is to one's in-group has been connected to being politically conservative. As seen in these charts here, we can see the differences between these groups are very apparent when people were asked if they thought a vaccine should be mandatory, with the more loyal group wanting it to be more mandatory, while the less loyal group favored personal choice more. This is just one example of the multiple ways we saw moral values and identities impacting one's thoughts about the COVID vaccine.
Thanks, Jack. So if you look at something like the vaccine hesitancy that led to the US measles outbreak, you saw people at different ends of the spectrum of moral values choosing not to vaccinate their children for very different reasons. And so if you were going to try to take that on, there wouldn't be a single message strategy that would work for everybody and the reasons that were behind their decisions not to vaccinate their children. So Jonathan Kennedy, who's at Queen Mary University of London, said, these attitudes toward vaccines are really about how people think the world operates. So you have these deep structural determinants of vaccine hesitancy that go way beyond information and awareness. One of the things that we've seen happening with conspiracy theories, for example, like QAnon, is the ways in which that they prey on people with specific identities and what they think of as what affirms or doesn't affirm their own identities, particularly as a parent or somebody with a particular role within their community. So our recommendations are to really understand what is most important to the communities that you're trying to reach and where you're trying to overcome vaccine hesitancy. And really understand those worldviews, identities, and moral values. And look at calls to action that are specifically designed to resonate with how the people that you are talking with what they want, what they desire. If you're talking with somebody who's more individualistic, really talking about how they're going to be safer, how they're going to be able to return to activities that are important to them. If you're talking to somebody who has a more collectivist mindset, then you would want to really talk about what they do for others and how they protect others. So our next principle is to use timing to your advantage. People trust most what they hear first. And so this theory, inoculation theory, is likely familiar to many of you on the call. Coincidentally named, it turns out to be really helpful in building trust in vaccines. It also matters that in a time when we perceive that insights are changing, that news is changing, that hearing that not just the message the first time, but hearing it consistently from different sources is also really important to people trusting it. So we want to hear different messengers using the same message. What's also interesting is that when people hear that message the first time, that then becomes the standard against which they critically analyze subsequent messages. So of course, we don't have the opportunity to get there first in terms of vaccines, but there are some spaces where we could get there first. For example, sharing the stories of people who are getting the vaccine. I read a fantastic one today from South Dakota about a man who knew that his boyfriend was going to be the one delivering the vaccine, and so he taped a wedding ring, an engagement ring to his arm where the vaccine would go. And so this story about vaccination became a love story as well. And so really kind of pulling the veil back on the vaccine with those kinds of stories that are compelling, not just because they're about vaccines, but because they're about what we care about as human beings, can really be helpful. And also, you know, one of the things that we're hearing is about the sort of perception that the vaccine has been politicized. So really telling the stories of the scientists who have been developing these vaccines and what that process looks like. This is the first time in human history that a vaccine has been developed within our attention spans. This is an extraordinary opportunity to increase literacy in what vaccine development looks like. So we love this game that came out of Cambridge, which combats political misinformation. It's called Go Viral. And what it does is it puts you in the shoes of somebody who is generating misinformation. And what the scholars found is that this pre-bunks conspiracies and makes people much more resilient against them. Repetition is also really important. One of our participating scholars, Lisa Fazio, has done work around repetition in one of our favorite studies. She asked people whether the garment that Scottish men wear is called a sari or a kilt. Everybody went into the study very clear that they do in fact wear kilts, but a group that was subjected to increased repetition that garment is called a sari were actually far more likely over time to say, no, it's called a sari, not a kilt. So that just demonstrates how powerful repetition can be, both in terms of misinformation and accurate information. Maya Hutchins, who studies political communication, says that inoculation theory is really perfect. So we really want people to have the correct information initially, and that's going to make people far more resilient against misinformation. So when it comes to timing, you want to identify some of the content areas where you have an opportunity to get there first, to share context that people may not have heard before, and really inoculate people with some effective messages that resonate with their worldview. You want to think about what else is happening at the same time, and how those events, even if they're completely unrelated, may affect how much people trust your message. And you really want to repeat, making sure that people hear the same message from a variety of trusted sources. Speaking of trusted sources, you really want to think about who the right messengers are. Effective messengers are trusted leaders and community experts. And Jack alluded to this earlier. We trust our in-group over our out-group. And of course, it's really important to stay away from those political sources.
Yeah, and so one of the interesting findings about messengers was we asked the question first, where were people getting advice about the pandemic in general? Where was your most reliable health advice from across the 4 countries? And within the countries, it didn't differ too much. With national health professionals, scientists, and researchers, as many on this call are, and your personal doctor were the top scorers by far. Friends and family were followed, and government politicians about 22%. There's a host of other things we asked about too, which were lower than pharmaceutical companies and government and politicians. And interestingly, the most low of all were celebrities in terms of where people were getting their health advice from during the pandemic. And also we asked where people wanted to get information from their community. And we saw that in the 4 countries, people they'd prefer information about a vaccine from people in their community rather than distant experts. And also, I didn't mention on the last slide, but that was across health advice for the pandemic, but we saw the same exact findings for information about the vaccine, which is not too surprising, but kind of encouraging.
So Neil Lewis pointed out that for Black Americans, for instance, barbershops turn out to be a really great place to get health information. And so having doctors train barbers to talk about this turns out to work really, really well. So we really need to figure out who the trusted resources are, community by community, and make sure that those individuals are well trained in sharing effective messages that are going to be trusted. So we want to urge you to understand which sources of information trusted messengers are citing within the communities that you're trying to reach, and also recognize that there are trusted messengers in both offline and digital communities. And you really have to listen to both to identify who the trusted individuals are who can help you create and share those messages that are going to be trusted by a community. So our next principle is to make your content concrete, supply a narrative, and provide value. Everybody on this call knows this well, that information alone is not enough. It's not enough to simply say, this is the vaccine, this is when it's going to be available, this is when you're going to get your 2 doses. that's not going to help to for people who are vaccine hesitant to convince them that they should take the vaccine. So we really want to create content that avoids ambiguity. So using concrete visual language and avoiding abstraction, using that really concrete, specific, and visual language helps people to avoid inserting their own bias. When something is abstract and we don't have complete clarity, we tend to fill that abstraction with our own sense of meaning. So one of the things that we often urge the scientists who we work with to do is to talk in definitions rather than using specific terms associated with their expertise. And as I alluded earlier, really using stories to help people make sense of what's happening. Our brains are powerful sense-making machines, and narratives are the building blocks of our memory. So if we are not providing that narrative, people are going to invent it. And that's one of the places that, you know, we suspect that conspiracy theories come from. And they have to provide value. They have to help people answer specific questions like, is the vaccine safe for my loved one? How soon will I have access? Really helping people to make their own plans and choices. One of the things that came out of our conversations as well is that the vaccine hesitant communities and anti-vax communities have really been effective at using regret, choice, and control around to advance hesitance. But those could be flipped. You could talk about, you know, you could say, wouldn't you regret if you didn't get the vaccine and you transmitted the disease to someone you love? You could talk about the choices available among vaccines, and you could talk about how choosing to get the vaccine could give you more control over your life and help you come through the pandemic, and all of us come through the pandemic more quickly. So Paul Slovic told us, you know, it might be really effective to say, wouldn't you regret it if you didn't get the vaccine and your loved ones got ill? One of the things that came across loud and clear in our discussions is the ways in which abstraction can lead to misinformation. When experts communicate in their own language, it comes across to non-experts as abstractions, and we're left to figure it out for ourselves. So that can lead to misunderstanding and create an opening for misinformation. So, and narratives make sense of things. Our colleague Ellen came across this example of a mother sharing the heartbreaking story of her twin boys, both of whom were received the flu vaccine, but because their community hadn't reached herd immunity, one of them became ill and died.
Yeah, and related to what Anne's talking about with abstraction, we saw this loud and clear in the data where, not surprisingly, but a strong majority, 87%, wanted more data available showing how many people in their country had taken the vaccine already when it was released, as we had the survey before it was released. And also related to people not having the information, in our survey, 87%, again, a strong majority, agreed that they thought vaccines would save lives. And some of this included some who were saying they weren't willing to take the vaccine themselves. And Anne, I also wanted to mention that we've got some great questions in the chat, really detailed questions. So feel free to keep those coming. I'm trying to answer them as we go, but we'll also have some time at the end for some discussion of the questions as well.
Yeah, and if there are any that you think we need to talk about right away, please don't hesitate to jump in.
Yep, I can do that.
Great, thanks, Jack. Thanks for paying attention to all of those. Okay, so one of the things that we thought was really interesting as it relates to abstraction is the fact that abstraction is guided by things that seem far away physically, that seem likely to happen far in the future or have happened long ago in ancient history, or that seem unlikely to happen to us. And so we loved this example from the Washington Post as a way of overcoming those forms of abstraction and making, so what this does is allows you to enter your zip code, and then you can see what would happen to your community if everybody, if all of the people who have been lost to us were in your neighborhood. And one of the things that we saw is that the city of Gainesville, where the University of Florida is based, would be completely gone. We would have lost everybody. As the rates go up, we understand that the pain of COVID-19 is becoming much more immediate. But for those who might deny its impact, this is a really effective tool to help them understand the scope of what is happening. So content needs to be concrete, supply a narrative, and provide value. We can overcome abstraction with messages that situate the importance in terms of a local threat, likelihood, timeliness, and possible harm to people like you. And we can flip those themes of choice, regret, and control and frame them in positive ways to increase vaccine uptake. We can even identify messages that are consistent as the knowledge evolves. Like, for example, a process for creating a vaccine is something that will stay consistent even as we have new insights that come from the science. It's critical to build that narrative, to situate facts within stories of individuals like the newly engaged couple that I shared earlier, and people really reclaiming control of their lives to make them believable and relatable. And really talking in details and definitions rather than acronyms and jargon. Our next principle is to recognize that communities have different relationships with vaccination. So we see things like loose versus tight societies, loose societies being places where wide cultural variation is tolerated or celebrated, where you have different feelings toward authority, and where you have these perceptions of politicization. And it's also true that things like language, metaphor, and messages and imagery look different and have different salience within different societies. So for example, one of the things that we found really interesting was a study that Emily Brunson participated in which the Somali community was deeply concerned about vaccinations. And the reason for that was that they were concerned that it wasn't halal. And so by really listening to that, understanding it, they were able to address that very specific concern. And then, of course, this has been much talked about as we talk about vaccine hesitancy. This fear, particularly in the African American communities, about experimentation symbolized by the Tuskegee syphilis study. And these kinds of fears are so well founded and extremely legitimate, and it's easy to be compassionate and understand why somebody might be wary.
And Anne, we just had a quick question in the chat about defining tight and loose societies.
Sure. So this is, we've got more about this in the guide and the specific theories that we're drawing from on this and the scholars who contributed to this theory. But a tight society is one where people will have a set of social norms that are pretty rigidly followed by most people within the community. And so that's one where if you've got a tight society and you've got authority saying we should be getting the vaccine, you're going to have much more likelihood that people are going to get it. Whereas a loose society, you have this tolerance for people sort of going their own way, making their own choices, not adhering to a particular norm. I hope that that's helpful. So really understanding whether that community is one that tolerates those high levels of deviance or ones that are going to be much more expecting people to adhere to a particular set of behaviors and norms. Really recognizing that relationship that people have in their community and with authority and framing your message accordingly. And using social media as a way to really get deeply immersed in online communities as a tool for listening to understand what people's specific fears and concerns are, rather than simply saying, this is a good idea. listening, as Emily did, to understand whether there are specific concerns that might be overcome, and recognizing that particular communities really do have important and legitimate reasons to be fearful of new medical interventions, and addressing those transparently. So our next principle is to change social norms to help gain acceptance. So in a social norms approach, you identify social influencers, people who are deeply connected and respected within a particular community. You highlight the bright spots, people who are adhering to the desired behavior, not the people who aren't, and really shift those beliefs with new norms. So this is a place where a celebrity combined with an expert could be an effective messenger in demonstrating that a particular behavior is the normative behavior for a particular community. So norms campaigns have been highly effective at reducing smoking among teenagers, around reducing binge drinking. They're most effective with younger people, although they have been used effectively with older populations as well.
Yeah, and we saw evidence of this, the strength of social norms in the survey for sure. So reflecting the strong social norms about personal choice in our 4 Western countries, majorities in all the countries agreed or strongly agreed that people should have a personal choice whether to take this vaccine.
Thanks, Jack. So the social norms piece is really important. We're doing some other work on mask wearing, and one of the things that some of that research that was conducted by our colleague, a social psychologist named Colin Smith, he pointed out that in the early stages of his work, it seemed that people's choices around mask wearing were very much guided by their political affiliations and worldviews. But that was very quickly overtaken by people's perceptions of what people like them will do. So we need to really think about how we can highlight people within particular social networks who are getting the vaccine, not the people who aren't, and really work with influencers to shift those perceptions. And we also need to do some social norming among communicators and public health professionals, and move away from that information deficit model to science-informed frameworks like this one that really work within how people see the world. So our next principle in the home stretch is to evoke the right emotions. It's so tempting to use emotions that like shame or fear. And what's interesting is that some of the research suggests that specific emotions invoke specific behaviors. So we have to choose them intentionally. And fear can be particularly unpredictable in terms of how people will respond. So while fear could lead us to fight, it could lead us to flee, it could lead us to freeze, it could lead us to tend and protect. It could, in the best case scenarios, inspire high levels of information seeking. But given that it's so unpredictable, it might be more effective to look to some of the pleasant emotions more than unpleasant emotions. For example, emotions like pride, parental love, and hope are associated with agency and action. We're far more likely to act out of pride than shame or guilt. In fact, shame can lead us to hide our behaviors. We may even hear people saying, oh, I've already had COVID-19, or I got the vaccine already, whether they did or didn't. But hope is associated with action, and parental love is probably one of the most powerful emotions that people experience. And some research suggests that we may respond to the stimulus of parental love, whether we're actually parents or not. So this was the only clear don't that we heard from the researchers that we spoke with. We really don't want to be using shame. And when you do that, you can really create stigma, and shame can, those kinds of appeals don't work in the way that people think they do, and it may end up getting people to lie to you. So shame is going to be is one of the things that we really want to stay away from. And fear can be counter-argued. You can say, oh, I'm not afraid. And we've certainly seen some very public instances of high-profile people saying, don't be afraid of this, right? So you have this very immediate sort of ability to counter-argue it, but you can't argue with parental love. Given that it's so powerful.
Yeah, and going back to the hopeful messages, this was actually the strongest message we found across the survey in our message testing, was a hopeful message. And if you look at this chart, you might see, oh, well, actually, many didn't strongly agree that the vaccine was our best chance to end the pandemic. But this is a chart of only people who were vaccine hesitant. So it's really fascinating, because even 41% of the vaccine hesitant in our survey, which was around what we see in society, about 40% were vaccine hesitant, 41% of them said the vaccine was the best chance of ending the pandemic. So pretty interesting, the hopeful message was so strong. And related to that, looking at other messages of emotion, we also tested about regret. And we saw that strong majorities of respondents agreed or strongly agreed that they would feel regret if they did not choose to get their child vaccinated with the COVID vaccine, and then their child became sick.
So when we talk about emotions, we want you to be very precise in the emotions that you use. Avoid shame, fear, sadness in your calls to action. We tune them out, and we really especially tune out shame messages because we want to retain that positive sense of self. We want to tap into constructive emotions like hope, pride, and parental love, which can motivate people to act and also affirm that positive sense of self. Okay, last one. Our perceptions of the motivations of the messenger matter, as do our own motivations. So motivation can help build trust. It certainly can increase information-seeking behavior. Our motivations are tied to what's important to us. And one of the things that we see is that when people are highly motivated, as they are with this, they may be more likely to seek out accurate information. So we're seeing these kinds of stories where people are sharing their motivation for participating in vaccine trials as a way of building transparency and trust. But you could also see that being harmful. For example, Emily said, you know, if you're an immigrant and you're concerned, for example, about ICE being at a vaccination site, you're probably not going to go and get that vaccine because you feel vulnerable. So creating these sort of understanding of the motivation, being very transparent about the motivation is important. So there are two ways that this plays out. One is really to understand the motivations of your community and what their information-seeking behavior looks like. What are the questions that they have? What are they motivated to seek out answers on? And being transparent about the motivations of the messenger. Even if you're with an organization that most people would say, this is obviously an organization that's motivated to care for people, being really transparent about why it is you're advocating for people to get the vaccine. Some of you may be familiar with the photocopier study from the 1960s in which somebody was allowed to cut the line because they said that they said, may I please cut the line because I need to make copies, which is exactly the reason that everybody wanted to be in that line, but they were able to cut because they shared their motivation, and really sharing that because even when you think it's obvious or so transparent can be critical to achieving trust. So these are our 8 principles. we're happy to, we recognize that there are some things that are missing here. For example, there's so much great work that's been done around nudges and the power of nudges, making those vaccines very easily accessed. And so we recognize that this is in no way comprehensive, but it is a good running start from which practitioners and public health officials can begin to develop compelling messages. So this QR code will take you directly to the guide that we've developed. It will share the 8 principles as well as some of the research behind them. The survey data that Jack was sharing, it also includes a long list of the theories that we consulted in the development of this tool and brief bios of all of the participating scholars. We are regularly tweeting examples that we see of effective communication in this space. And it looks like we're probably going to be doing more work in this space as well. So we'll continue to share that through Twitter as we find it. And so I am going to see if I can stop screen sharing so that we can answer questions, and I can also see the chat.
Yeah, Anne, that, thank you so much for that. That was awesome. We had a couple questions that were, I don't know if you can see the chat now, but some of them were a little bit like two-parters that I answered some about the survey, but I was wanting to get your advice on some of them because they were related to more broadly about the research. So one was, have you studied how people you know better justify contrary behavior? For example, people who believe in COVID, know it is real, know they should or shouldn't engage in certain behaviors, but then do the opposite. Relates to both getting vaccines and also broader health behaviors like social distancing and masks. And we didn't necessarily test that in the survey about the justification, but I was curious if you had any thoughts about that on the research.
Question, particularly in terms of people's sort of risk-seeking behavior. And that's a vast area of research. I am not steeped in that area of research, so I would be hesitant to speak to it. But I do agree with you that that's something that's really important to be thinking about and looking at.
Oh, and we just had a new question that is, did protecting others work as a motivation to be vaccinated?
It can work with people who have that collectivist worldview. It's not going to probably work with somebody with a more individualistic worldview. Yeah,
we definitely saw that in the survey as well. And I think some of those message testing, they scored kind of in the middle of the pack, not as high as those hopeful messages. But we did test that message, like, would you get a COVID vaccine to protect others? And it did pretty well. But again, not everybody was convinced. Sadly, no silver bullet here.
Any other questions or observations?
We had another one I would like to ask you a little bit more about from the questions, which was, says some research suggests the purity sanctity issue is a big one for vaccine hesitance, and reframing vaccines as teaching your body to naturally fight off infections versus lots of medical interventions required if you had a bad infection. Did you find the purity sanctity moral foundation you discussed earlier to be also important in your research? And I said, regarding the survey, we saw some of that it scored pretty middle for the message testing, and that the hopeful messages were higher than it. But I was curious if you had more thoughts on that one, Anne.
No, that is one, I love that message, and that's one that I would really like to test. I think it's something that would only, if it worked, it would only work with a very specific group of people. You could see how it might be a double-edged sword as well, that the same people who would be thinking about a vaccine as protecting the purity of their body would be alarmed about, this sort of foreign substance being in their body as well. So that is certainly something that I would really want to test with a specific community.
Yeah, and we got a bunch of questions coming in now. One from Robert O'Malley. Could you expand a bit on the best practices for engaging, collaborating with the non-scientist messengers? Example, faith leaders, tribal leaders, civic org leadership.
Yeah, so I think it's important to first figure out who those influencers are, the ones that are really trusted, because there are certainly plenty of non-scientific messengers who are not trusted, who are talking about this, but some of them are trusted. So first identifying them and then training them on the science and on these effective messages that are going to work with their specific communities. We're big fans of Betsy Pollock at Princeton, and we were particularly enamored of a study that she did working with junior high school students, where she was able to reduce bullying across middle school students throughout New Jersey by identifying the young people that other students most enjoyed spending time with, and then training them in techniques of tolerance and anti-bullying, and really figuring out which of those young people were the ones that others wanted to spend time with was really important. The control group was a group that was, or the other group was a group that was identified by school administrators as being the most popular, the most influential. And one of the things that her work found was that working with those students was in no way as effective as working with the ones that young people enjoyed spending time with.
Yeah, and just to follow up a little bit on that, from the survey, we saw the celebrities in general scored very low. So putting them out there alone to talk about vaccines might not help, but maybe we didn't test this specifically, but combining them with scientists could be more effective.
Yeah.
It's like we got a lot more questions, Anne.
Oh my goodness. Okay. I'm just reading these along the way. Yeah, I think, so I'm looking at Jean's question about the fact that vaccines may contain substances like preservatives that people worry about. And I think that I would, number one, I am not a statistician, I'm a communications strategist. So I would look at things like, I would look at, this is a space where, number one, I would really listen to those concerns and then check them out with people who are developing the vaccines and can give factual answers and then addressing them. So if there is, this concern that there's formaldehyde in the vaccine, actually going and doing the homework to find out whether there is formaldehyde in the vaccine, at what levels, whether it's harmful, and then communicating that back to people who are sharing that concern in a way that is meaningful to them. Or in talking about adverse reactions, my dad came home from, my 87-year-old dad came home from his doctor's appointment, and he said, my doctor wants to take a wait and see approach to me getting the vaccine. And having paid attention to the trials and the adverse reactions, my point to my dad was, Dad, you are at far greater risk from getting COVID and getting sick from COVID than you are from having an adverse reaction to the vaccine. So really providing meaningful comparisons to people that help them to manage their fear can also be really helpful. I think this question, I'm not sure who's asking this question, is there harm in continuing to highlight that certain populations may be more likely to be vaccine hesitant? Yes, I think that could be very harmful. One of the things that we talk about when we talk about news coverage is the sort of paradox of novelty, that news organizations cover topics because they're new, they're interesting, they're novel, but that transforms them into something that can be perceived as normative by their readers. So in Gainesville, again, going back to some of our mask work, we had some very highly documented videos of young people going out to the bars without wearing masks, without social distancing. Even though that may only be about 5% of our student population, with 95% really adhering to the rules, staying home, staying away from the bars, distancing, wearing masks when they go out, there becomes a perception that everybody is doing this and that people like me are actually going out and I'm the only one missing out. So I think that is a really important concern in an area where we would really love to have the opportunity to do some work with journalistic organizations to talk about the role that their coverage may have in perpetuating some of these really harmful norms. In terms of how we found and connected with the participating scholars, so Annie Neiman is our research director, and she and our research team working with Jack and our research fellows looked at some of the researchers who had published a great deal on vaccine hesitance and reached out to them directly, inviting them to participate in this, and many were not available, but the vast majority agreed to participate, for which we were very grateful. Can you say more about ways of being transparent with communicating your motivations as the messenger, particularly when speaking with someone who has a very different worldview and values than you? So this could be, this could take a bunch of different forms. For example, you could talk about it in your role. Why do you care about this? Why is this important to you? So if you were talking to a parent, for example, trying to encourage them to get the vaccine, you might say, I want you to be there for my daughter's wedding and she wants you there too. So it's really important to me and to your grandchildren that you do absolutely everything that you can to protect yourself. So being very clear about what your source of authority is, saying, you know, I've spent a great deal of time looking at the descriptions of adverse events. You should talk to your doctor about it, but it doesn't seem that you would be likely to have any of those. As your daughter, as somebody who wants you in her life for a long time, it's important to me that you protect yourself. And so, so really being clear about your sources of credibility and about your motivations for wanting somebody to get that vaccine. So we are right at 12 o'clock. Jack, is there anything else that we should say? Just in summary, there's a lot more in here. These are such great questions. If you have follow-ups, I would invite you to send us an email. I'm happy to answer those. And also you can shoot a note to us on Twitter as well. Jack, or Rose, is there anything that we should have added?
Just one quick thing. There's a great question in here, and I don't think necessarily that, I'm not sure people could see all the questions, but it's a political question, kind of forward-looking about the new administration and whether there might be more vaccine hesitance because of the incoming administration, or there might be less because of the perception to rush the vaccine. So that's kind of an interesting one to think about going forward, and it's very hard to predict that. I think we're now seeing higher levels of vaccine hesitance among conservatives. So the more liberal people maybe were nervous about that at the start. So I would assume some of them will come back to being less hesitant for the COVID vaccine. But I'm not sure the state of where that's going with the conservative element to that. But that's an interesting forward-looking question. And I don't know if you have any thoughts on that one.
Yeah, no, I think that's something that we all need to be paying close attention to as this unfolds. Great. Well, thank you so much, Rose. Thank you so much for inviting us to join you all today. This has been really fun. And thank you. These are some of the most thoughtful questions we've gotten in any of our webinars. So thank you very much for all of those.
And Anne and Jack, thank you both so much. It was so wonderful to hear from you, and thanks to everybody who attended. As Jack said, we'll send around the recording and the guide for your use, and really hope to see some of these principles implemented in our vaccine communications. So thank you all again.
Thank you. Take care, everybody.
Thanks for having us. Bye.
Bye.